Aloha! My name is Sofia Zekovich-Roth. I'm the clinical director at Mind and Body Works, and I'm a doctor of acupuncture and oriental medicine.
And I am Ivana Zekovich, marriage and family therapist, life coach, and a fitness expert at Mind and Body Works.
We're here to tell you more about posture, ergonomics, and way to improve upon those as you embark upon telemedicine practice.
So stick around and we'll show you some amazing stretches that you can use in your daily work. We're going to start with bad posture. Sofia is going to demonstrate how to do it better than what I'm doing. What usually happens when we get to work, we sit down, we try to adjust. The chair might be comfortable, uncomfortable, but what usually happens, we're going to tuck our feet under our chair, lean forward, try to call our clients, and as we start, we find ourselves leaning more and more forward. Another scenario that often happens, at least to me, is if I get too tired or I need a little break, I'll find myself sliding into my chair and reaching forward with my feet. Now, as you notice, Sofia continued to sit in a perfect posture. So she'll talk more about it, how to do a perfect alignment before you start seeing your clients.
All right, so when it comes to having perfect posture, nobody really has perfect posture. But what we hope for is that when we do sit down in the chair, we have an alignment that allows for about 90-degree flexion in the knees, 90-degree flexion in the hips, shoulders are back, aligned with the ear, and our arms, if we have a desk in front of us, should also fall with 90-degree flexion in the elbows and perfectly straight wrists.
I will be demonstrating the warm-up exercises using the office chair. Now, one advantage of office chair is that I can move from side to side. I'm going to start with the shoulder rolls. And I'm going to keep my hands on top of my knees, allowing my shoulders to roll back. And at the same time, moving the head forward. From there, I'm going to take it into back stretch. I will be demonstrating how you can use the chair to push against it. And then bringing it forward. Another advantage of the chair is as I'm opening up the chest, if I want, I can use the back of the chair and push my chest even more forward, allowing the head to come front. From there, I'm going to take it back into the hip stretches. Now, this is where the chair comes in very handy, and as I can move all the way, 5 in one direction, 5 in the other direction. You can do the twist using the chair. And the last one is I'm going to be overlapping and reaching from one side all the way back to the other. And the last stretch and a warm-up I want to demonstrate, you can combine your wrist stretches with the neck. And you're ready to go.
All right, so we're talking about ergonomics, or setting up the workplace in a way that it supports natural postural alignment and helps us prevent repetitive strain injuries. Usually at the beginning of the day, we all start off with good posture. We're sitting back in our chair, shoulders are relaxed, head is back, hands are aligned and set up to start typing. Unfortunately, as the day progresses, we tend to slouch, shoulders come forward, head comes forward as we're trying to bring the eyes closer to the monitor, and our posture starts to suffer. If we find ourselves working with a laptop computer, what we'll find is that for a short time it works very well. However, spending a whole day using this tends to cause some problems. We get a little more tension in the neck, we get a little more tension in the shoulders because we try to, over time, bring our eyes closer to the screen. So how do we remedy this? How do we fix this? Well, we're going to have Eva sit back. We're going to introduce a ball. We're going to put this nice squishy ball behind Eva's back and have her lean back into the chair. The ball doesn't take up a lot of space, but it gives Eva that proprioceptive feedback so that if she starts slouching forward and moving forward, the ball moves and it reminds her that she needs to reposition herself. All right? Because the laptop sits really low, we have to kind of pick our battle. Do we want to be able to see the screen very well, or do we want to be able to type with a good ergonomic setup? What I recommend for long exposure to this kind of a computer setup is that you work with elevating the computer. So you can work with the stand or simply use one or two larger books to allow for a greater height of the screen. What we're looking for ideally is that the screen would be at the eye level. So here we see that we would need to introduce a couple more books in order to bring that to a comfortable position for Eva. Right? While we bring in a few more books, we can also talk about how we would deal with the typing scenario here. So we would bring in another keyboard. So this would allow us to keep our elbows at that 90-degree angle and keep our wrists in neutral position so that we can type without any risk of developing carpal tunnel. All right, we're going to elevate the computer a little bit higher and see if we have a better setup. So we see that in this position, Eva is able to keep her eyes on the level with the upper portion of the screen. So this is something that she could probably do for several hours without fatiguing her shoulders and the neck. Another thing I want to discuss here is that ideally when it comes to monitor, we're looking at about no more than one arm length away from our face. So somewhere between 20 inches and an arm's length. If you find yourself creeping forward, you might need to adjust the size of the letters on your screen or recheck your position. All right, we're talking about ways to remedy some of the postural faults that might develop as a result of doing this work for prolonged hours. So the first issue we're going to address is the one of craning the head forward. So this is the remedy for all the craners. So if you have a tendency to, after a few hours, let your head and the shoulders come forward towards the screen, this is the way to maybe break that habit. First stretch we're going to do are those famous shoulder rolls. So we're bringing shoulders forward, then all the way up to the ears, as high up as they'll come, then all the way back, and then letting the shoulder blades slide down the back. So really large circular movement with the shoulders. This allows shoulders to realign, which will bring about the realignment of the neck and then the head. All right? From here, we're going to go into a little bit of a chest stretch and a little bit of a neck stretch. So here we're using the chair to allow chest to gently open by bringing the arms back. And we're bringing head backwards into a stargazing position. So allowing a little bit of a compression in the cervical spine by bringing the chin up, and having that support from the chair makes this a safe stretch. Right, from here we're bringing the hands behind the head, bringing the head down, allowing for the stretch in the back of the neck. So this is a really nice gentle stretch. And we're going to slowly come out of this, providing a little bit of a resistance as we come up. So we're going to do that again. So coming down into a gentle stretch, feeling the pull in the back of the neck. And then as we come up, slowly providing resistance with the hands against the head, allowing those neck muscles to realign. All right, we're doing the gentle spinal twist. Main thing here is sitting as upright as you can before you move into the twist. Then as you twist, you can use the side of the chair or back of the chair to help you move further into a twist. And then you're looking over the shoulder with your head, allowing the head to align itself with the rest of the spine. From the spinal twist, we're going to go into a little bit of a hamstring stretch, so addressing the back of our thighs. We're bringing one or both legs forward, extending them fully. Then we're dorsiflexing our feet, so pulling the toes in towards us and going down into a forward fold. Slowly coming up. And from here, we're going into the hip and butt stretch. So we're crossing one leg over the other, and then with the straight back, we're gently leaning forward. And slowly coming up. So it can be a center stretch, or you can gently move from one side to the other and go a little deeper into it. So again, remember that with all the stretches, we're looking for a gentle pull, not pain. We recommend that you take breaks in between each of your patients. Ideally, at least once every hour. We've introduced you to some of the sitting stretches. Now we're going to show you a few simple standing stretches that you can add to your repertoire. The first one Eva is going to do is going to be a modified downward dog or a standing forward fold. She's using a desk for support here. Legs are straight. Feet are about shoulder distance apart. She's pulling back, letting the head relax down. She can even let the head hang here. So getting a nice stretch throughout the spine, getting a nice stretch in the back of the legs. She's also getting a stretch in the chest and the front of the shoulder here and in the arms. All right, from here, Eva is going to move into a cat stretch. So good old cat stretch, great stretch for the entire back. Her feet are a little closer here, knees are soft, and she's rounding her back and then pressing it down. So really rounding, pulling shoulder blades apart, trying to articulate through the entire spine, and going down into back extension, allowing the head to come up as well. And from here, she's going to go into a mountain climber, a really great stretch for the back of the legs, so giving us a stretch for the calves and hamstrings, also getting a little bit into the groin, so stretch for the hip flexors. And she's adding a back extension with the head back here. So going into that counter stretch for the neck. So doing both sides, so really nice stretch for the calf and the hamstrings, the front of the hip, and getting a stretch in the neck as well. Thank you everyone for joining us today. We hope you've enjoyed the stretches we've introduced you to. And please do remember to take care of yourself as you take care of others. Aloha.